step that's most important that people can take to prevent reduce the potential for hospitalization and death is to get vaccinated, get boosted. He's not telling anyone to accept anything. He's just conveying to people what they can do to protect themselves. He's also said very clearly, and I think he's illustrated that in this and what he said publicly, as have our doctors, that we're going to be direct and straightforward with the American people. We know cases are going up. But we also know that if people are boosted, it is going to significantly reduce their potential to be hospitalized and certainly prevent to die. And that is what we're conveying to the public.
Okay, so let's be straight here for a second. Cases are rising across the country. Tests are hard to come by in many places, or there's long lines for them. Schools are closing again or having to go virtual, and that's not just because of the weather in some parts of the country, but because of the pandemic. There is a sense among many that the country has lost control of the virus. Would the White House agree with that?
We would not. And here's why. We're in a very different place than we were a year ago, Ed. 200 million people are vaccinated. Those are people who are protected, seriously protected from illness and death from the virus. We have also just purchased the largest over-the-counter purchase of tests in history, 500 million tests. That builds on the fact that we have already distributed 50 million tests back in December to rural health centers, to community health centers. The fact that we have 20,000 sites across the country where you can get free tests. The fact that next week people can get reimbursed for their tests, and we are going to continue to build on that. It also, on schools, I would say 97% of schools are open across the country, and the president wants school to be open. That's why months ago, even when people questioned his advocacy for this funding, he advocated for $130 million in the American Rescue Plan and $10 billion to cover testing, even when many people said that was not necessary and was not needed. That has all been distributed to states. If states have not used it, and some have not, and if school districts have not used it, now's the time to use it. So I would note that we have taken steps to prepare for any contingency, any moment, and we're working to implement and build on that from here.
You just mentioned outbreaks here at the White House. Is it a large number? Is it anyone? I know there's a policy that you're only really going to let us know if it's the top 4 individuals in the government or their spouses, but has there been a wide outbreak here in the West Wing or across the White House campus?
Well, our policy is that, which I think is important for the public to know, because it is in the public interest to know, and of course your interest. If there is anyone who has a close contact, as deemed by the White House Medical Unit, with the president, the vice president, the first lady, or the second gentleman, we will make that information available, as we have done, as those instances have occurred. And I was only conveying there are breakthrough cases here. There's 2,000 people who work on the White House complex, right? The 99% of them are vaccinated, and there will be breakthrough cases here. Thanks to the vaccination, those cases have been mild. But again, there are rising case numbers across the country, and we expect to be in line with that.
Just on another topic, you kind of discussed this with Darlene, but Senator Durbin today suggested that Build Back Better is kind of taking a back burner spot.
So a lot of alliteration there.
A lot of these there. As voting rights pushes ahead as we near the MLK holiday. Is that the White House's stance right now, that voting rights is sort of issue number 1 up there, or should be?
Well, we're working, and you've seen, I'm sure, the Dear Colleague letter that Leader Schumer put out just a couple of days ago, and we're working in lockstep with Leader Schumer on that, on getting voting rights done. He's obviously put out a timeline for that. We're going to work with him on getting that done. But that doesn't change our commitment to Build Back Better. Go ahead.
Thanks, Jen. Why hasn't the CDC revised the definition of what it means to be fully vaccinated yet, given that the president has spoken about boosters for months now?
Sure, it's a good question, Jackie. I don't speak for the CDC. Obviously, they speak for themselves, given they make decisions based on data and science. So I would point you to them. I know they have a COVID briefing tomorrow.
Had the president, emphasizing the importance of boosters for months, and people have to ask the question, or a lot of people are asking the question, would revising the guidance cause some sort of logistical or political or economic consequence that the White House isn't ready to embrace, something like not being able to go to restaurants, or people go to offices, or industries that have suffered labor shortages?
We have boosters available for every American. They can get boosted now, regardless of what the CDC guidance is, whether were just approved for the booster or you were approved weeks ago.
So Expect then that guidance will change eventually?
It's up to the CDC, and they make those decisions based on data and science.
Will we have any update on when they might make a decision on that, given that there's been so much
I
time?
encourage you to ask them that question when they participate in the COVID briefing tomorrow.
Okay, and then similar line of questioning, but
Sure.
this time about the FDA.
Okay?
There have been some decisions by the FDA over the last few months that have happened without consulting the panel of independent experts that we saw for authorizations for the vaccines themselves. We haven't seen that with boosters. A couple examples, on the 19th of November, FDA authorized the booster for all adults. 29th, the CDC announced people 18 plus should get boosters. December 9th, the FDA authorized boosters for 16 and 17-year-olds, and just yesterday, the FDA amended the emergency use authorization for the Pfizer booster for kids ages 12 to 15. So I guess my question is, why has the protocol been different with the boosters than it was for the emergency use authorization of the vaccine itself?
Jackie, the FDA makes their own decisions, not driven by what the White House is telling them what to do, so I would point you to the FDA to get any comment on that.
So it doesn't, I guess then the White House is not, or the FDA is not getting rid of its independent panel of experts by any White House guidance.
Absolutely not. And again, I think they would confirm that themselves. And I think what's important to step back here is recognize we're still in the middle of a pandemic. There are still far too many people who are not vaccinated. There are still kids who are at risk because there are not enough people, adults, vaccinated. And I think what we're all collectively trying to do here is protect more people and save more lives, whether you work here or at the CDC or the FDA.
Is the president then okay with the FDA making these authorizations without calling their panel of experts?
Again, I would point you to the FDA, and they can speak to their decision-making process.
Okay, and then real quick on the Florida Surgeon General and testing, what's your reaction to his comments that the U.S. needs to unwind its testing psychology where people are planning their lives around testing? Is that sound medical advice in the White House view?
I would really point to our own health and medical experts on when tests should be administered and utilized, and our focus on making them more available, accessible, and free to the public. Oh, good.
Real quick, is there any reason why the CDC did not include a testing component when it revised its guidance for isolation? Given that there is such a scarcity of tests, there's been some criticism that the CDC couldn't tell people they should get tested when they emerge from isolation, because then people try to get tests and they're not available, and it might blow back onto the administration.
Again, the CDC makes these decisions. I expect they'll have an updated guidance if it hasn't already gone out.